Why is TIA a warning sign for vascular dementia? Imagine experiencing sudden weakness or numbness that lasts only a few minutes and then disappears. That's often a transient ischemic attack, or TIA, sometimes called a mini-stroke. While it might seem minor, it actually signals something much more serious happening inside your brain. A TIA is a warning sign for vascular dementia because it reveals underlying issues with blood flow in the brain that can lead to long-term cognitive problems. To understand why, we need to look at how blood moves through the brain. Blood carries oxygen and nutrients vital for brain cells to work properly. When blood flow is temporarily blocked during a TIA, it doesn't cause permanent damage right away. But it does show that the blood vessels are not functioning well. The same problems that cause a TIA, like narrowing of the arteries, blood clots, or damage to small vessels, are also responsible for reducing blood flow over time. If these issues persist, they can cause ongoing damage to brain tissue, which gradually impairs thinking, memory, and other mental functions. Think of the brain like a city with roads that deliver supplies. If some roads are blocked or damaged, deliveries slow down or stop. Small blockages or interruptions may not cause immediate destruction, but over time they build up, leading to a decline in city services. This is similar to how repeated TIAs and small strokes cause cumulative damage in the brain. This process is called multi-infarct dementia, a type of vascular dementia, which develops from multiple small injuries over years. Each event may seem minor, but together they chip away at brain function, leading to problems with memory, reasoning, and problem-solving. Research shows that people who have a TIA are more likely to experience a decline in cognitive abilities over time. Even if the TIA doesn't leave visible damage on scans, it indicates that the brain's blood supply is compromised. This ongoing vascular stress reduces the brain's ability to adapt and recover, known as cognitive reserve. As this reserve diminishes, symptoms like confusion, difficulty finding words, slower thinking, and trouble organizing become more noticeable. A TIA also signals a higher risk of future strokes. About 1 in 3 people who experience a TIA will have a stroke within a year. Half of these strokes happen soon after the TIA. This risk is because the same underlying vascular disease, such as plaque buildup in arteries or small vessel disease, is still active. Each TIA is like a warning light flashing that the blood vessels are not healthy. If these issues aren't addressed, they can lead to more serious strokes and faster progression toward vascular dementia. Recent studies involving thousands of people have confirmed that cognitive decline is more common after a TIA. Even though the decline happens more slowly than after a full stroke, it's still significant. People may notice problems with memory, concentration, or planning that gradually worsen. These symptoms tend to appear in steps, and like Alzheimer's disease, which usually declines gradually over time. Recognizing these signs early is crucial because it offers a chance to prevent further damage. So, what does this mean for stroke prevention and brain health? It highlights the importance of acting quickly when a TIA occurs. Immediate medical evaluation can help identify the cause and start treatments to lower the risk of future strokes. Managing blood pressure, controlling diabetes, treating irregular heartbeats, and lowering cholesterol are all key strategies. Sometimes doctors prescribe medications that prevent blood clots, reducing the chance of another TIA or stroke. These steps can slow or even stop the progression toward vascular dementia. It's also important to remember that many people have mixed types of dementia. Some may have both vascular issues and Alzheimer's disease. Having TIAs can accelerate cognitive decline in these cases, making early intervention even more vital. Every TIA is a sign that the brain's blood supply is under stress. It's not just a warning for a possible stroke, but also a signal that cognitive health could be at risk if the underlying problems aren't addressed. In summary, a TIA is more than a temporary problem. It's a clear indicator that the blood vessels in your brain are not functioning properly. This ongoing vascular trouble can lead to damage that accumulates over time, causing vascular dementia. Recognizing a TIA as a warning sign allows healthcare professionals and patients to take action early. By managing risk factors and seeking prompt treatment, it's possible to protect brain health, prevent future strokes, and preserve cognitive function for the future. Always consult your healthcare provider if you experience symptoms of ATIA or have concerns about your brain health.